My name is Ethan Gross, and I will be talking about leprosy, also known as Hansen's disease. Leprosy is a bacterial infection of the bacterium Mycobacterium leprae, or M. lepromatosis. It is spread through bodily fluid contact, specifically nasal fluid or coughing. Leprosy has many different forms, however the general effects to the dermis are the damage of nerves from the papillary layer outward, damage to dermal muscles, and a highly increased blood supply to dermal tissue. Specifically, these bacterium trigger the inflammatory response of the body, so the area is overfilled with blood, which puts pressure on nerves and over time damages them permanently. The main causes of leprosy are the bacterium Mycobacterium leprae and M. lepromatosis. Leprosy is usually dormant in the body for years before showing any symptoms, therefore affecting patients differently depending on how and when their immune system reacts to the bacteria. However, once symptoms are shown, the disease has a fairly predictable course. Leprosy causes inflammation in areas of the epidermis and damages the nerves in the dermis and epidermis. Symptoms of leprosy include mainly skin lesions and nerve damage. The lesions simply mark the area affected by the bacteria by inflammation. However, nerve damage can be much more severe. The nerve damage caused by leprosy occurs in secondary nervous systems. For example, sensory or motor nerves, nerves in the dermis and epidermis. These damages can lead to paralysis of appendages, inability to register pain, blindness, and dry or cracked skin. These symptoms alone are not terrible, but expose the body to further harm. For example, the loss of limbs or other diseases entering your system. There is no one cure for leprosy. However, some methods have proven to be effective. The current list of treatments include the antibiotics, usually a combination called MDT or multi-drug therapy, consisting of 3 unpronounceable antibiotics, reducing swelling to prevent nerve damage, and surgery to drain excess fluids and prevent further nerve damage. These treatments are aimed not to destroy or eradicate the bacteria, but to prevent more damage from occurring after the symptoms. Antibiotics are first used to try and kill the bacterium, but this is extremely difficult because Mycobacterium leprae and M. lepromatosis cannot be cultured in a lab, therefore tests have to be run in organisms. Antihistamines can be administered to reduce swelling by closing blood vessels in the area, reducing the blood flow, and decrease pressure on nerves, which can cause irreparable damage. Finally, in some cases, surgery can alleviate fluid buildup in an area and relative pressure on nerves, again causing damage. Anyone can be affected by leprosy. However, it is much more common in tropical and subtropical areas. Warm and wet climates. Roughly 300,000 people worldwide have reported cases of leprosy, with only 200 cases reported per year in the United States. Over half of the people affected by leprosy come from India. Leprosy has a few characteristics that make life more difficult. First, your appearance. It is common with people who have leprosy to have lesions in fairly visible places, on their face, arms, legs, and hands. Patients are sometimes ridiculed for their appearance because of the disease. Additionally, the slow loss of feeling in extremities can affect a person's ability to work effectively. Finally, as with most diseases, affected persons are advised to be careful not to be exposed to another disease while their immune system is impaired. Leprosy is the same and even more important because many of leprosy's symptoms reduce the body's ability to fight off other diseases. This here is my model of the dermis and epidermis. Please don't laugh. It's made out of sugar-free box cake and Twizzlers. Twizzlers represent nerves, which are being constricted and damaged by the inflamed surrounding tissue. I tried to differentiate the layers of skin by coloring them. It works in my head because the top layer is red, and that is what you would see in an inflamed area of the skin, with all of the hemoglobin in the blood being brought to that one area. In reality, the swelling would occur in the dermis more than the epidermis and apply pressure on the nerves from below. The surrounding tissue becomes inflamed because of the bacteria, which puts continued pressure on dermal nerves, damages them. Thank you so much for watching.